So an FNA is short for fine needle aspiration, and it's used to help diagnose a thyroid nodule or a neck mass. FNAs are critical for ENT care because they help us diagnose neck masses or thyroid nodules. FNA is short for fine needle aspiration, and it's the least invasive way to collect a biopsy. When a patient comes in for an FNA, they'll come into the lobby and check in. When we bring them back to the ultrasound room, we'll do a quick ultrasound of the nodule to collect some pictures and measurements. And then I walk them through the next steps, which would include the numbing injection, which is lidocaine. It's typically a pinch and a burn at first. After that, I go back through the numb spot with a few small needles to collect some cells from that nodule. The entire process for one nodule usually takes maybe 5 to 7 minutes for the entire biopsy. The only restrictions when you have a fine needle aspiration, the day of the biopsy, we ask you not to do any heavy lifting or strenuous activities after the biopsy. Otherwise, you can eat and drink and do everything like normal. The following day, you can go back to all the normal activities. Lots of times patients will have a little bruise in that area, or they may have some soreness there, but usually just a little bit of ice or Tylenol or ibuprofen to help with that. So the most common reasons that we would do an FNA at ENT would be for any kind of head or neck mass. That would include any lymph nodes, neck masses, parotid masses, or thyroid nodules. The results are about 95 to 97% accurate. There's always, some room for error in the results. As far as collecting a specimen, most of the time our non-diagnostic rate falls around like 7 to 10%. A non-diagnostic sample means that there's either too much blood in the specimen, or sometimes there's just not enough cells for the pathologist to be able to say one way or another. A lot of patients will come in with the perception that when they're having an FNA, fine needle aspiration, that there's incisions or that we're removing the nodule that day. The whole purpose is just to collect cells from that nodule. A lot of patients will ask about if there's any certain prep for the procedure, and you can eat and drink like normal that day. There's no special instructions. The only thing that's of most importance is not to be on any blood thinners prior to the procedure. So if you're taking any prescribed anticoagulants, one of our nurses will contact you and tell you when to hold those medications. Baby aspirins and 81 milligram aspirin is typically okay for this type of procedure. Not every lump or bump requires a biopsy. However, having a consultation with one of our providers here at ENT will better guide us as far as if we need to proceed with a biopsy.